So I had just been diagnosed with cancer and been given a tentative treatment plan. This opened up a whole new chapter in this journey that involved a lot of moving parts, planning, scheduling, things like that I had never really thought of. Good evening, everybody. I'm Lee. This is video number 3 in my series, and I consider this to be one of my most important videos preparing for my cancer treatment. So why do I think this is so important? Preparation will help us cope with anxiety and fear that can come from a diagnosis like this. So by being prepared, we know what might be coming next. If you see me looking off to the right a little bit, it's because I think it's important enough. I want to make sure I cover everything from my notes. The first step in preparation is family. We want to prepare our family for what's going on. Tell them everything. Don't hold back. Tell them the diagnosis and then tell them the treatment plan. How many chemo treatments are you going to have? How many radiation treatments? If those are part of your treatment plan, let's talk about those with the family and let's let everybody become engaged with that. Is surgery part of the plan? Are you going to have surgery? I don't know, but maybe that's something you need to talk about with the family. By keeping everybody informed, you're going to reduce their fear and anxiety. So we all have medical conditions, and your medical condition may have you seeing one or more specialists. I know mine does. Make appointments. Plan to see your GP and each one of the specialists that you see regularly. So one of the specialists I had to go see was a dentist. I wouldn't have thought of this on my own. This was insisted on by the oncologist. He's seen patients develop dental issues and even lose teeth because of the chemo and the radiation. So one of the things you want to ask when you go to see the dentist is, are your teeth and gums healthy enough for the procedure? If not, you want to get those fixed. Neck and head radiation absolutely affected my teeth and gums. Have a thorough exam, include x-rays, and have that report sent over to your oncologist. Okay, so a gastroenterologist. This might be necessary for your treatment. For mine it was. With head and neck cancer, absolutely had to go see the gastroenterologist. Discuss your options based on your treatment and condition. Due to my treatments, my throat would constrict to a point where it would become practically impossible for me to eat or drink, and therefore we would have to insert a peg or stomach tube into my abdomen. I was not in favor of this at all. This is something I just didn't really want to do. However, after discussion with the gastro doctor, he pretty much told me that if we waited too long, that very condition that's preventing me from eating or drinking could very well prevent me from having the tube inserted. And once we've reached that point and I can't have the tube inserted, I can't eat or drink, the options become pretty limited on how I'm going to get nutrition into my system. And just to let everybody know, that procedure is very short, very quick, very easy, and it's outpatient. But again, talk to your gastroenterologist if that's part of your treatment plan. I will make a separate and more detailed video about the PEG tube and how that works later. My gastroenterologist insisted on me seeing a nutritionist. Again, this is something I wouldn't have thought of on my own. Nutrition, of course, is critical during your treatment. Because of my initial reluctance to tube feeding and a lack of practical knowledge about how to actually use the tube, I didn't get sufficient nutrition, and I ignored the warning signs, and I ignored my wife. And I ended up being admitted to the hospital for 5 days due to malnutrition and dehydration. Don't do that. Learn from my mistake. Do your research and consult a professional certified nutritionist. Preferably one who has experience with cancer patients, and if possible, one who might have experience with your particular type of cancer. Discuss the options regarding regular feeding through the PEG, if you're going to have one. Insist on practical demonstration and don't accept just an email and a pamphlet and a pat on the head and send you out the door. We could have avoided a trip to the hospital if we had known what we were doing with that PEG at the time. So I have high blood pressure, high cholesterol, and high blood sugar. So I have to see a cardiologist and an endocrinologist on a regular basis. And I've been under their care for 3 years. Discuss your medications with them and possible side effects with chemo and radiation. They'll appreciate you coming in and talking to them about it, so they'll know your situation ahead of time. Again, we're trying to avoid any surprises for your doctor. One of the questions you want to ask is, how am I going to take the medication? Will it fit in the PEG? Will the tablets fit? Will the pills fit? If we have a PEG, we're going to discuss the size of it and talk about the medication is, can I crush the pills? Is that safe? Are they timed release or are they regular release tablets and it's okay to crush them? Talk to your doctor about your medication and find out if it's safe to do that. Are there different medication options available if I'm using the PEG? One of the things I did is I moved to an injectable insulin because the tablets were just huge and they didn't dissolve very well in water. My endocrinologist suggested going to insulin because it would just be easier in the long run and have a better effect. One of the other things to look at is transportation. How are you going to get to and from your treatment appointment? Is it going to be family? Are they going to drive you to and from your appointments? If so, who, when, and how are they going to get you there? Have an A, B, and C plan. Don't miss your appointments. Just going to make things worse. Also, maybe friends are going to be helping out. If you have a friend that's going to take you, always have the same thing. Plan ahead. Have an A, B, C, D, even an E plan, because friends do forget stuff sometimes. Maybe a car ride service, taxi, medical transport, etc. Something that's going to get you back and forth there. If you're going to have to use one of these services, how much is it per trip? Is it covered by insurance? If not, maybe setting up a contract price with the driver ahead of time. One of the things you want to look at is entertainment. It sounds kind of silly right now, but start thinking about that. Movies, books, games, hobbies, things like that. Things you're going to want to do when you're just sitting around, because you're not going to feel like getting up and being out and about. One of the things I did is I watched YouTube videos and learned quite a bit on how to cook. I decided I'm going to be the next master chef or something. We'll see how that works out later. And the other thing I want to talk about, start thinking ahead. Your mental preparation. This is going to be difficult, physically, mentally, and at times it's going to be difficult emotionally. There are days that are going to be more painful than others. There are days that you're going to feel nauseous, dizzy, and uncomfortable at best. There are days you're going to be angry and frustrated, and there are days that you're not going to want to continue treatment. But remember, the treatment does end. All of this does stop. The pain will go away, and you will begin to feel better. Now, I can honestly say I had every one of those days. Every single one of those days I've had it. The treatment did end, and right now I can honestly say it was all worth it. Finally, all of this is based on my experiences and things I learned as I prepared for treatment. Some things I didn't know ahead of time. There's not a guidebook on what to do and how to prepare for this. No one told me to go see my specialist and talk to him. It just made sense. It seemed like the thing to do. I even changed my endocrinologist so that he was in the same hospital and on the same network. And that was for my convenience. And it also allowed for that inter-hospital communication so they could all talk to each other. I would never have thought of going to see the dentist. Once they explained that to me, it also made sense. Planning ahead for transportation also made sense at the time. Traffic and parking absolutely sucked. And I can assure you by week 3, I had no desire to drive at all. And I'm not really sure if I even could have. Think ahead and plan for as much as you can imagine. Let your family help you plan and even divide up some responsibilities. Give everybody a stake in your treatment and recovery. Help reduce the load. That helps them and helps you, because now they're part of it now. You really do need that support structure. You need them to be around you. As much as you don't want to talk to anybody or have anybody touch you, you need them to be around you. You need them to talk you down, keep you going. You do need that. During the inevitable gray days that are coming up, lean on your support structure, whether it's family, friends, staff at the hospital, and of course you can feel free to contact me as well. It's not single combat. It's a team event. We can all be in this together. We can all help each other out. And remember, if just one person gets something out of this one video that helps you make it through it a little bit easier, everything's been worth it for me. Thanks very much. We'll see you on video number 4. Don't forget to hit that subscribe button. Thanks.